Hi there, my name is Alma Huerta and I will be presenting a journal article on the association between dietary pattern and incidence of cholesterolemia in Korean adults, the Korean Genome and Epidemiology Study. Some background on this study: cardiovascular disease, CVD, is the leading cause of death for both men and women, according to the CDC. Dyslipidemia is a recognized cause of CVD. Statistics show that there was a 53% prevalence rate in the United States among adults. Dyslipidemia is making its way through Korea and other Western populations. The study revealed that 57.6% of men and 60.4% of women in 2010 had dyslipidemia. Dietary patterns are important determinants and risk factors for several forms of cardiovascular disease. Koreans tend to eat a high carbohydrate diet, which is associated with changes in blood cholesterol levels among this population. It's important to look at the risk factors and behaviors leading to cardiovascular disease because it is the leading cause of death for both men and women. And unfortunately, cardiovascular disease is actually highly preventable. The research shows that it can be avoided through proper diet, nutrition, and exercise, and so it's important to spread the knowledge and different factors that may weigh into obtaining this disease and how to prevent it. The study investigates gender-specific associations between dietary patterns and risk of developing cholesterolemia, specifically in the Korean population. Cholesterolemia is the presence of an abnormal amount of cholesterol in the blood, whether it be high LDL or high HDL. This study was done using data from the Korean Genome and Epidemiology Study, also known as KOGES, and it is a large community-based cohort study. So the way the study worked is it divided its sample into two areas. It had one for the low LDL cholesterolemia analysis, and the other one was for the high LDL cholesterolemia analysis. So the first one we're going to look at is low HDL cholesterolemia. 7,515 participated at baseline. However, many were excluded for several reasons. 691 were excluded because they refused to participate in the follow-up examination. 3,872 participants who had low HDL cholesterolemia at baseline were excluded. 230 participants who had cancer or cardiovascular disease. 19 who had implausible energy intake. 217 participants who did not complete a food frequency questionnaire, FFQ. 31 participants who had missing information. So overall, 2,655 subjects were entered in the low HDL cholesterolemia analysis. Of these, 1,716 were men and 939 were women. Now we'll be looking at the high LDL cholesterolemia analysis. Again, 7,515 subjects participated at baseline, but many were excluded for the same reasons, just a different amount. 691 participants who refused to participate in the follow-up examination, 2,395 who had high LDL cholesterolemia at baseline, 69 patients who had cancer or cardiovascular disease, 26 who had implausible energy intake, 262 who did not complete a FFQ, 67 who had missing information. So after all of this, 4,005 subjects were entered in the high LDL cholesterolemia analysis. Of these, 2,057 were men and 1,948 were women. And again, this study focused on the Korean population, and it tended to focus on middle-aged to older Korean adults, specifically ages 40 to 69 years old. And it focused on the Koreans population living in the Ansan or Ansang areas. For this study, anthropometric and biochemical measurements were conducted biennially as supplementation to the interviewer-administered questionnaires regarding demographics, dietary habits, health condition, and medical histories. And now we will be diving into the stat analysis portion. For this study, dietary patterns were separately derived for men and women using factor analysis. Identifying the number of factors to be retained was done by using an eigenvalue of greater than 1.3 criterion. Characteristics of subject at baseline are expressed as categorical variables or continuous variables. Comparisons of variables at baseline was performed by the chi-square test and linear models. Time-dependent Cox proportional hazard models were used to identify the hazard ratios. 95% confidence intervals were used to analyze developing low HDL cholesterolemia or high LDL cholesterolemia. And for this study, all p-values were less than 0.05. As for the results, the multivariate Cox proportional hazard models were used to examine the risk for cholesterolemia according to dietary pattern score. 4 dietary patterns were derived by categorizing food items into 27 food groups. The first food pattern was the prudent pattern, and it consisted of a high intake of potatoes, legumes, vegetables, mushrooms, fish, and shellfish. The second was coffee, fat, and sweet pattern. This consisted of a higher intake of coffee, oil and fat, and sweets. The third was split into 2 categories for men and women. So for men, they had the whole grain pattern, and women had the white rice and noodle pattern. And the fourth pattern was the westernized pattern, and this was just a high intake of cereal, snacks, breads, pizza, hamburgers, nuts, fruits, and dairy. The results showed that a prudent pattern had a 22 through 24% lower risk of developing low HDL cholesterolemia in both men and women. The coffee pattern, on the other hand, had a 26% higher risk of developing high LDL cholesterolemia for men only, after adjustment for potential confounding factors. Other dietary patterns had no significant findings that associated them with cholesterolemia in either men or women. For conclusions, a 6-year follow-up period revealed that a prudent dietary pattern was associated with a lower risk of developing low HDL cholesterolemia in both Korean men and women. However, men that had the higher risk of developing a high LDL cholesterolemia went on the coffee, fat, and sweet pattern. The study suggests that there are gender differences between dietary patterns and risk of cholesterolemia in middle-aged and older Korean adults. So therefore, the study is calling for future randomized clinical trials to confirm this association and reveal the underlying mechanism. There were several biases pointed out in the article. The population solely focused on middle-aged and older adults. So this means when we're trying to apply the findings of this study to younger generations, it might not be effective, considering younger age groups might have or tend to have different dietary patterns. Random measurement errors were caused by within-person variations of dietary assessment. This could especially be the case when someone is filling out their FFQ. Decisions regarding the number of factors extracted and food groupings were subjective. This could create bias, especially when creating the FFQs. And non-participation and non-responses can also introduce major biases. This was not pointed out in the study. This was something that I simply observed, that several participants were disqualified for several reasons. And had these participants not been disqualified, they could have potentially altered findings, but providing more insight between the association of dietary patterns and cholesterolemia. My concluding thoughts on this article: I do think the study was effective, and the findings were applicable to the desired population. It focused on gender differences and the association of dietary patterns and cholesterolemia. And I do agree with them thinking when they say that in the future, randomized clinical trials have to be done in order to reveal the underlying factor to determine the differences between the genders and how dietary patterns affect their cholesterol levels in their blood. And these are my references. Thank you so much for watching and listening. I hope you enjoyed. Thank you and Goodbye.